I'm Dr Mark Weatherall. I'm a consultant neurologist in the NHS. I work in Buckinghamshire Healthcare NHS Trust based in Stoke Mandeville Hospital in Aylesbury. Privately, I work at the Medical Chambers Kensington and also at the Chiltern Hospital and the Shelburne Hospital in Buckinghamshire. I chose to specialise in neurology because when I was training as a junior doctor at the Whittington Hospital in North London, I saw a number of very interesting neurology patients. At that time, neurologists came up from the National Hospital at Queen Square to provide a consultation service once a week. And I had some very interesting conversations with Nick Fox and John Scadding, who were consultants that came to see our patients at the Whittington. After that, I applied for and got a job as an SHO in Oxford, and within a week of doing that job, I knew that neurology was for me, and I've never regretted that decision. As far as headache is concerned, that came to me as a specialist interest when I was doing my specialist training in the Northwest, in Manchester and Preston. I saw some interesting patients and I got in touch with Peter Goadsby in London. He very kindly answered my questions about my patients and also encouraged me to come and study with him, which I did. And ever since then, I've had a specialist interest in headache disorders. I find my job enormously rewarding. On a personal level, neurology is never less than fascinating. In every clinic, there's always something interesting and intriguing. In regard to the headache patients in particular, I like the fact that almost always I can do something to help, even if it's just making a diagnosis or listening to people talk about their problems. All too often, that's an experience that they've never had before. Headache medicine is a really exciting area to be in now because there have been a lot of new treatments coming through in the last few years, and there are going to be others coming online in the next year or two. So our ability to help people with chronic disabling neurological disorders, ones that are often undervalued and under-recognized, is really powerful, and it's a great place to be working now. Looking after patients with headaches can be very challenging, partly because the headache disorders themselves can be quite refractory to treatment in many cases, and also because people with chronic headaches often have a number of different things going on all at the same time that contribute to their problems. And it can be difficult to unpick that, but it's very rewarding to do so. It's also the case that I really need to clone myself because there are so many people with headache disorders in the UK that could benefit from people who have genuine expertise in headaches. I haven't quite worked out how to do that yet, but one day maybe I will. And in the meantime, we need more headache consultants, and I'm working very hard with my colleagues in BASH and the ABN to provide them.